Response and Recovery Committee to order. Madam Clerk, and we got Sandy, O'Brien, who's here to call the roll and help officiate, take meeting minutes of today's meeting. Sandy, can you please call the roll?
Yes. Woodward?
Here.
Gershenson?
Here.
Biz?
Here.
Zach?
Here.
Jackson?
Here.
Boobs? Here. Miller is excused, is that correct?
Yeah, correct.
Nelson?
Here.
Use your pen. There's a pen right there.
Staub?
Here.
Weipert?
Here.
Kuhn?
Here.
Mr. Chair, you have a quorum.
All right, the quorum is established. Thank you. Phil, I was going to call on you because I'm in a different location. So we're going to use, if Phil lead the Pledge of Allegiance.
Thank you.
Okay.
Pledge allegiance. Ready?
Allegiance to the flag. Yep.
I pledge allegiance to the flag.
United States of America. One nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner.
I got that flag.
I appreciate it. Thank you. I'm in a different location because the home offices are all being used. Brings us next to the approval of the minutes from the previous meeting. So is there a motion to approve the minutes? Moved by Commissioner Jackson, seconded by Commissioner Nelson. Any discussion on approval of the minutes? All in favor of approving the minutes, say aye.
Aye.
Opposed, say nay. The minutes are approved. Let the record reflect unanimously. It brings us on to approval of the agenda. I would like, if someone can move, we're going to remove item number 4, if that's okay with folks. If we can approve the agenda minus item 4, we'll take that up at another time.
So moved.
Moved by Commissioner Spiz, seconded by Commissioner Gershenson. Any discussion about approving the minutes as presented, the agenda as presented? Hearing none, all in favor say aye.
Aye.
Aye. Opposed, say nay. Great. Let the record reflect that the minutes, the agenda is approved unanimously. That brings us to public comment. And Andrew, I don't know if you're on. There you are.
I'm here.
Do you have any public comment?
We currently have no public comment logged in and no email submissions.
Okay, great. Seeing no public comment, we'll declare public comment closed. And that'll bring us to communications. This is the County Executive COVID-19 update. I believe everyone received the weekly report. Can we get a motion to receive and file that report? Moved by Commissioner Jack, seconded by Commissioner Weipert. Any discussion? I believe we have folks in the administration that are on, if people have had a chance to look at it, or any discussions on where those expenditures have been going of late?
Just, it's a lot of salary. It's a lot of salary. I mean, it's dated Friday, which is included the latest pay period, but there's a lot of salary there. We're taking care of the people.
The hazard pay piece is reflected in that, correct? Any further discussion? Seeing none, all in favor of approving receiving and filing the communication, say aye.
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 Opposed, say nay. And let the record reflect that the communications are received unanimously. That brings us to the regular agenda. First item up, we've got the Board of Commissioners creation of the Open Together Community Response Recovery Fund and establish procedures for disbursements to nonprofits. Is there a motion? Moved by Commissioner Zach, seconded by Commissioner Nelson. Discussion, and let me tee up, I believe Chief Deputy Hillary Chambers is on. If you want to speak to it. Can I give an overlay of what we're accomplishing here? Hillary, are you there? She was there. I saw her.
Hi.
Hi, Hillary.
Hi,
Hey, there you
hi,
go.
everybody. Hi.
How are you?
So this is a continuation of the $10 million that you all had authorized a few weeks ago, or lost track of time, but in your previous meeting, and asked us to come back to you with a plan for what would be the best, most efficient way to spend that money. So we came back, we had a call with some nonprofit organizations last week to get input from them. We talked to the United Way of Southeast Michigan. We talked to the Community Foundation for Southeast Michigan. We outreach to as organizations that have been interacting with nonprofits during the pandemic, and also evaluating the support that they need going forward. We also consulted with the guidelines that have been provided to us by the Treasury Department, and worked with our outside experts to ensure that when we put forward a application, that it'll be clear what types of expenditures we're looking to support. We thought that it made sense to do so in varying levels. Have a variety of sizes of nonprofit organizations could use support. So we came up with 3 levels: the 50,000 operational grants, the enhanced operating grants up to 100,000, and then a large community service grant of $500,000. We thought that would give us a way to support the largest number of people and to really target their COVID-related and other expenditures. So we'd like to, as soon as we can gain your approval, we want to get this moving as quickly as possible, knowing that organizations need the resources as they begin to offer more and more services and come back online. So I'll be happy to answer any questions. The criteria that we came up with is very much, directly from the guidance that we received from the U.S. Treasury. So again, just making sure that the applications and the funds are spent accordingly. I think
I got a couple hands up. Yep, Commissioner Gershenson, followed by Commissioner Zach, Commissioner Gershenson, and then followed by Commissioner Kuhn. Commissioner Gershenson.
Thank you, Mr. Chair, and thank you, Ms. Chambers. I am extremely supportive and thrilled about this. I was just on the phone with Gilda's Club this morning that provides psychosocial support for men, women, and children with cancer, and they've been conducting all their support groups virtually, and they've heard that several of the hospitals have cut off some of the support groups that they were sponsoring due to budget concerns. So I think this is just a great idea to help fill in the gap of some of the psychological needs, but any kind of support groups or nonprofits that were thriving before and that are adjusting to the new situation. So thank you.
Mhm.
Great. Commissioner Zach, followed by Commissioner Kuhn.
I love the concept, and it makes so much sense to hire United Way, because frankly, they have been contracting with nonprofit providers for years and years and years, and they've really rallied in this. My question to you, Hillary, is we're going to be paying them some type of administrative fee. Is it a percentage? Is it hourly? Are we going to say up to 5%? How are we doing that? It wasn't clear to me.
The contract that I think you might have received has been adjusted to say it had originally indicated direct costs. With additional conversations, we've adjusted it to say up to 2%.
Okay, now it's clear. Thank you.
Commissioner Kuhn, followed by Commissioner Weipert. Commissioner Kuhn.
Yeah, thank you, Chair. I had a couple questions based on the documents that you provided. Let me ask this. I know you've indicated, Hillary, that there's 3 tiers. what was the rationale for the 3 tiers? And can you give us some examples of organizations that might possibly fit within each of those 3 tiers?
Sure. Well, the rationale, and I think this will also go to, why we thought that United Way was the best partner to administer these funds, because I had a long conversation with the Community Foundation, and I also think they do excellent work. But United Way had previously, because of some regional efforts, they had run very early on a grant program for nonprofits, and found that these, and their tiers were a little bit different. But in the call that we had with nonprofits last week, it was clear that many of them wanted the smaller amount, the up to 50,000. So I think that you'll see a lot of interest in that, and that I would say could go to like an Oakland Literacy, who has been providing online services and maybe needs $10,000 or $12,000, or it would be a smaller amount. I think the up to 100,000, it's not only to help with the pandemic response, but also it would be entities who are providing a service to organizations as well. So I would see, and then the 500, I think, is really a special category. I mean, that would be, those larger nonprofits that are providing a valuable service, and they would not be considered in the same way as the first 2 categories. The first 2 categories will be done, really through a much simpler application process. And the 3rd category, the larger grant category, would be really more of a white paper that they would submit to United Way and to us. It wouldn't be just a simple application. So we would be requiring a lot more of those organizations that could be eligible for up to 500,000. And I would think that those grants would be much smaller and would go to the larger organizations that we are all familiar with, like OLSA or Oakland Family Services or Common Ground, or those Haven would be probably someone that you would consider in that larger category. So I think there would be a smaller number of nonprofits that would qualify under the larger amount.
Okay, great. That's very helpful. Mr. Chair, I had a couple other questions. Is it okay for me to keep going?
Absolutely, please do.
Okay, it indicates that the applicants must agree to reporting requirements due 30 days after expenditure of funds or January 30th, 2021. So is it expected that there will be a report 30 days after expenditure of all the funds or some of the funds? What was the thought on that?
Well, 2 thoughts. One, I think it's pretty typical in a grant that you are, that you will have to report 30 days after you've spent the money. So someone, 50,000, let's say they spend it just on what they have to do to change their organization to reopen. So they spent the 20,000. I would expect that we would see immediately that report from them. But we put in the later date as well, because we want to make sure that if it's a larger grant and if they're spending it over a longer period of time, that we have all of the paperwork that we need in time for our own reporting requirements. I mean, we want to have everything, by the end of January. So that was the reason why we put the second deadline in there for those that spend it throughout the course of the year. But for most people, I would expect that they spend the money and 30 days later submit a report.
Okay, and
I'm not necessarily suggesting, I guess we could look at it that way. If you're getting towards wanting to get a report every 30 days, like if they got 100,000 and they spent 20 and then 20 and then 20, I wasn't thinking that we would need to require that they submit every 30 days. I thought my sense was that we would require that they submit after the expenditure of resources.
okay, well, great, thank you. With regard to the oversight group, it indicates that, what their responsibilities will be. I was wondering, is there some sort of report that the oversight group will provide to the to the commission or commission committees on that? And
I think that might be a question for the chair.
Okay, all right. Is that something, Mr.
I think
Whitford?
that's, I think that's, yeah, I think that's fair to say, that a report or summary of activities when they do meet, to the board, and maybe include it if it happens in concert with the weekly reports that we've been getting, we can include that in there. If we want to come up with some language, I think that's perfectly reasonable.
Okay,
I mean, I do think that the work of the review committee or the oversight committee will be at junctures, right? We'll get the application approved. We'll get the, and then the intensity of once processes the application, scores the application, makes the recommendations, we'll have a checkpoint there.
yeah, and in looking through the contract that's attached, it indicates that United Fund would have to provide a monthly report to the oversight committee. I was wondering if that also could possibly be provided to the board.
Where, Commissioner Kuhn, like in the contract,
That is-
it has a monthly.
Yeah, I'm sorry. That's under the contract, item 4.3 says that the contractor shall submit a written report to Oakland County on a monthly basis, documenting each recipient of funds dispersed by the contractor under this amendment. I was wondering if that could also be provided to the board.
I'm just looking at the contract real second.
I mean, we will want you to know right away when the grants are made. We will want everybody to know what organizations in Oakland County have been supported by these resources. So, I mean, I would assume that, as soon as the grants are made, we'll inform you of that process. And I hope that happens in the next 3 weeks.
Okay, well, great. Thank you very much for your responses.
Mm-hmm.
Thank you, Commissioner. I've got Commissioner Weipert. And then Commissioner
Mr. Chair.
Commissioner Weipert. Commissioner Weipert.
Thank you, Mr. Chair. We're gonna be, I know it's right in the resolution that we're gonna not allow any duplicative efforts, right? Expenditures. Seems like a lot of the nonprofits the county is supporting right now with, we supported some food banks and we're giving PPEs and things like that. But is there gonna be some overlap, or we're gonna try to control that?
Well,
Right.
I would have 2 thoughts about that. One, the funding is they can't be getting money to do the same thing. So they can't use federal money and then get money from us for the same expenditure. But I do want to factor in, and they will ask on the application, have you received money already from Oakland County? I mean, I don't know that would be conclusive, because someone might, that we might have supported them right now because they're providing, a service during the pandemic, and then they may make a good case about why they need support going forward. So I don't think the fact that we've supported them so far disqualifies them, but I do think it gets factored in. And that's why I want to ask it on the application, just so we know, have they received money? I also believe that this should be for, organizations that are really focused, that are not necessarily regional in their approach. They're getting large amounts from other people. Like, we're looking for the organization that, that but for our support, may really struggle. I mean, we have a lot of nonprofits that are larger, that are getting lots of other monies, and we may see a targeted purpose for our monies. But we also are looking for, another level of nonprofits that we can help support, that are an important part of our Oakland County fabric.
Yeah, Dick, I wasn't trying to mean we disqualify anybody. I know
Right.
if a food bank's got the need every day or every 3 times a week or every week, so it's ongoing. So I get it, and they'll be supplying services, and a lot of them also do clothing and mental health services and job searching services. So yeah, I understand it'll be ongoing. So Anyway, I appreciate it.
You're welcome. Did Spitz
Up
get his
next,
question answered?
Commissioner Spitz.
Hi, thank you, Mr. Chair.
Commissioner
Thank you,
Spitz.
Hillary. Thank you, Mr. Chair. Thank you, Hillary. I do have a couple questions. First one being, you mentioned the 2%, and this might be more towards Dave. Are we going to get an updated contract, and will it be in the file for Wednesday's board meeting? Because it's not in the package I have. Doesn't say anything about 2%.
That, Hillary, to your now, that was sent over. I guess I'm asking staff, do we have the revised version?
We did send it. Pete Mena from Corp Counsel sent it about 45 minutes ago. So I apologize. It was a change that we made this morning after having some additional conversations. So I don't know if it made it to the commissioners, but
Is
Okay,
Michael?
so if it's not here, it's going to be in Wednesdays then for sure.
We'll be. So we can do an amendment. I understand that we do an amendment on the floor to adopt it, but is Mr. Ward or
Yeah.
Michael Andrews?
We did not update the
Let
packet.
me know if we have it. It's what?
We did not have it for the packet, so we will update it. The packet.
Okay. Thank you.
Okay.
Similar along those lines, this might be in that too, in the update. Is there any caveat or statement in the update that mentions, based on the CARES Act, that if we are audited and we are found to be in violation, that those monies have to be paid back?
by the organization, by the individual organization.
Either the organization or United Way, either way, if they're administering it, I don't know who we could hold responsible for that, if it has to be the actual organization or United Way. So somebody should have to pay that back, I would think.
Yeah. I mean,
Otherwise, the
I do
county's
think-
going to be responsible.
I do think we have to hold ourselves accountable for that. I mean, we have reviewed all of these criteria in a similar way that we have to hold ourselves responsible for the small business grant. I mean, I've reviewed all these criteria with the consultants. We'll review the application with them. We'll review the grants with them. I mean, I think we're going to have to, this is such a novel situation in terms of, not needing pre-approval. I think we will have to hold ourselves accountable to make sure that every step of the way, we are providing the guidance on how the money has to be spent.
Okay. And if I could ask a question based on that, and it kind of goes along with Commissioner Kuhn's question, how does the oversight committee fit into this? What's the process flow from United Way, sending out the applications, getting submitted and picking it? Do they come back to the oversight committee first for review before the monies get awarded? What is the overall process before the monies get paid out? Is what I'm trying to
Yeah,
understand.
there will be a check-in with the oversight committee upon which the United Way has submitted their recommendations. I mean, I do think in any competitive grant process, my personal view is, you want the competitive grant process to play itself out. We don't want to be the ones picking. We want to have the ability to, to validate the process that they followed. But we've asked an independent entity to conduct the grant review process for a reason, because we want to have, like in any competitive grant process, we want to have an outside entity, like we did to a certain extent with the 12 committees on the small grants. But with the oversight committee, it just provides kind of validation that yes, what they did makes sense.
Okay, and that's just what I wanted to make sure so I could understand it, because I would agree with you. Having a third party is the best course of action. And with that, can you expand on, you mentioned a little bit earlier on why you briefly mentioned why United Way. Can you expand on why United Way and why we may not have competitively bid it in any way?
Like I said, I did have 2 long conversations with Miriam Nolan and her team at the Community Foundation, and then with Dr. Driver and her team at the United Way. And I think that they are both equally talented and professional partners in the region and would have both done an outstanding job. Thought that United Way was because they had just gone through a process where they had distributed, a larger amount of money quickly similar fashions and similar grant levels. I thought that might give them the ability to implement our grant more quickly, and they also might be just a tad bit more rooted in the nonprofit world as it relates to the pandemic and going forward. So again, I thought they both could do an excellent job, but I just those considerations. And also I thought that because Dr. Driver was a member of our Economic Recovery Task Force, she had already been involved in some of the discussions we were having. I thought that also was a factor to consider.
All right, thank you.
So
No more
the other
questions.
factor to consider is we had a longstanding relationship with them. So we already had a contract that we've amended for this purpose. So for all the reasons, I thought the community foundation would have done an outstanding job. I think it would have taken a little bit longer. And I thought that United Way was a more equal, quicker partner for us at this moment in time.
Thank you, Hillary.
Okay, the question, the staff's informing that the amendment for the contract has been sent around to everybody. I guess our decision is, do we want to do the amendment on the floor, or would we like to take the amendment up right now? What is the will of the group? Do folks want to take a second to look at it?
Okay, I would rather wait and have a chance to
that's fine.
digest it and do it on the floor.
With the
I would
understanding
agree
Ask
with you.
questions.
that we will be amending, we will, if we can advance this, we do so knowing that we expect this amendment on the floor of our board meeting. Commissioner Taub, I think I saw your hand.
Yes, I agree with Commissioner Zach. I'd like to see it, and I'm not getting it. I'm on my iPad, my own iPad, and I'm not getting anything there. So I think it would be
Okay.
a good idea for
Okay,
us
so
to.
we will hold on that, and we will do the amendment on the floor. Commissioner White.
Hillary, just to follow up or suggestion, when a lot of these nonprofits, they know when they apply for grants that they have to use, they've received other grants and they know they have to follow the terms of the grants. Otherwise there's a possible disqualification or payback. And so if you, maybe in your application process or our application process, if you're getting some smaller nonprofits that might not have extensive grant writing process or not received them, maybe you can put it right in your application that have you received grants before and are you familiar with grant process? And if not, maybe we can educate them a little bit on, that there has to be strict following of the purposes, just something along those lines.
That's a good idea. Uh-huh.
I mean, bigger nonprofits, I'm sure,
Right.
are gonna
They have all
know what to
mhm.
do. They know what to do. But you get some little, a small book club that's, some smaller, $10,000 a year nonprofit that's not that familiar with grant process. Might be nice to educate them.
Mm-hmm. It's a good idea.
Great. Commissioner Todd, did you have your hand up for a second time?
I'm sorry, sir, but I have, oh, yes, I did. This is the second time. I have a question about where the money is going to sit. Why are we not issuing the checks from Oakland County as opposed to United Way?
Well, I think that a couple of reasons. One, we're in the middle of this process with the small business grants. And, it requires that every entity become a vendor. And right now, fiscal services and IT are trying to create a more streamlined system, because not only did we award 800 small businesses a grant in the first round, but we have 3,000 coming in the second round. So, that has been where our system, quite frankly, is not set up to process those numbers. And that's going to be something that's been kind of a whole team effort to get those out the door. And it's ongoing. So given that experience, I thought that it made more sense in this instance to have a separate entity who has historically more quickly, people in the system and get to them. It would just mean that we would undertake the whole grant process. And I just thought, given their experience and having just done this, that it would be much more efficient process standpoint to have a third-party vendor do it for us.
So you're going to give them 2%, not to exceed 2%, which would be $200,000, am I correct?
It's not to exceed 2%, yes.
So they're gonna get a check for $200,000 for their service. I presume they're gonna do a terrific job. And plus, they're gonna keep $10 million in the bank for how long? Or will that be issued after the fact, after all the grants are there, so they can issue the checks?
No, they will have to, we will have to transfer the money to them before they issue the checks. And then if they don't issue, if we don't issue $10 million money to account.
And what is the time frame for that?
All of the funds from the coronavirus relief have to be expended by end of the year.
Okay, and was this bid, this contract with United?
It was not.
Well, that doesn't really quite follow our bid process, does it?
We have an existing contract with them. And so we moved forward on that contract.
That contract would be which contract?
I don't know the answer to that. We'll have to get you the answer to that.
Okay, and my question about people getting grants. Who can apply for these grants?
Well, the criteria lays out, they have to be Oakland County based or servicing Oakland County residents. They have to be a 501c3 nonprofit organization in good standing with the IRS. And it lays out exactly, can't be used for revenue replacements.
I'm sorry, what did you? I
It
didn't
lays
hear.
out in the resolution of the application.
Okay, so in other words, any 501c3, whether they're associated government organization, as they could be, a religious organization, a non-religious organization, do they all qualify?
501c3, they would qualify.
Regardless,
It could be a church, but if a church ran a 501,
okay. And what about our government organizations that have separate 501(c)(3)s? But I don't know if, well,
would be an example.
Just think. Perhaps, I don't choose that organization. I don't know, sister, so I'm picking on organization. I don't know if they do. Let's just or just say fundraising or say that the fundraising health is a 501c3, but their funding comes from the state, federal, and organization. Would that qualify?
In like Okie Health Network, them as a authority, or that they work with.
A governmental organ, okay, let's put it this way, schools often have 501c3s to, let's, school board is that additional funding, okay? What if a school board applied for a school, that type of 501c3 applied? It's a government organization, schools are funded by the government, and yet they have a private arm to raise funding for the school.
I mean, I think if they had a separate 501c3, they would apply. I mean, I don't, and they would make their case in their application about why they on the pan or to, I guess, that support students in distance learning. I guess C3 that was doing helping with distance learning that might make a good case or some type level of, but it has to be a standalone C3.
Okay, so it has to be a what umbrella station is. Is that correct?
Correct.
Does it state that parameters or the contract or not?
Commissioner Taub, I mean, if 501c have a, or do you have the IRS, they are for at least separate entities. And I
Okay,
realize what you're
so-
saying that
Right.
or the board will do for have a C3 education foundation, but it is a separate
Oh, it is a 501c3.
entity by itself.
So if a school board and they want to apply because they have distance learning problems, some children obviously can't afford an iPad or whatever, okay? They well, it says, where am I?
Are you talking about the oversight committee?
Yes, sir.
All right, so there's there will be a Republican commissioner and a Democratic commissioner and a representative of the administration.
Okay, so just 3 people, is that correct?
Correct.
I
Okay.
think the commissioner is suggesting that maybe the executive office should have 2 people so that it's balanced. But, you know, I think that we're all going to work so well together on this that I told your chair I was perfectly happy just having one representative on it. But I
Okay.
appreciate.
Are we good, Commissioner?
Thank
All
you.
right. All right. Okay, let's, Sandy, if we can call the roll on this, knowing that we'll also have an amendment on the floor reflecting the contract 2% change that we talked about. Sandy, can you call the roll?
Very good. Commissioner Gershenson,
Yes.
Biz,
Yes.
Zach,
Yes.
Jackson,
Yes.
Loops,
Yes.
Nelson,
Yes.
Taub,
No.
Wypert,
Yes.
Kuhn,
Yes.
Woodward.
Yes.
You have you have majority.
All right, sufficient number voted in favor of recommending it to the board for full consideration, and it will be placed on the regular agenda for that amendment. That moves us to the next item of the agenda. I've lost it. Hold on a second here. Apologize.
Excuse me, Mr. Chair, I'd
Yes.
like to vote yes, as long as it'll be on the regular agenda.
Okay, I just want to make sure, according to the clerk, can we reflect that Commissioner Taub also votes yes on that last question?
With the assurance that it'll be on the regular agenda.
It will be on the
Thank you.
regular agenda. We need the amendment.
Thank you.
Sandy, can we reflect that the record, I mean, it's called the vote, but do I need to reconsider the vote to allow Commissioner Taub to vote yes?
I don't think so. I think that's sufficient.
Everyone watching, okay, so yeah, everyone's voted in favor. It will be placed on the regular agenda. We will, and we'll be taking up that amendment as well. Thank you, Commissioner.
Hey, Chairman Woodward, may I make a comment about this next one? Because I can't stay the whole time because we have a call with our legislators at 2. So
Yes.
can I say something before I turn it over to Jennifer?
Sure. Yep, this is item 2. This
On
is
the
economic
financial
development.
coaches?
Yes.
I just want to say, because I'm really, really excited about this, and Jennifer Llewellyn will do a more fabulous job kind of explaining or thinking about it than I was. But I want to make 3 points basically. One, I want to not miss an opportunity to acknowledge Jennifer's leadership and the leadership of her whole entire team. I mean, to remind everyone that while this has gone on, her team has just been at the front lines of taking calls from people who are experiencing a very frustrating system that has been out of our control at the state level. And the state's done everything that they could to bring that technology online to really with an unprecedented number of unemployment claims. But just last week, Jennifer's team took 9,999 phone calls, which might have been the record, and they've taken that many phone calls almost every week. I'm not quite sure why we couldn't break 10,000, but that's another question. And they've gotten trained to not only help people, unlock their things. I mean, they've just been, states really relied on our team of folks to help people behind the scenes, and they've done a fabulous job. And I see financial coaching as really part and parcel of that. I think that we've already seen, and we're going to see more and more people needing the type of financial coaching that these individuals will provide in partnership with OLSA. And I'm so happy that we had a partner in the community that could step up and do this quickly, which is one reason we wanted to go with them. And we see them not only working with clients at the Michigan Works, but also, through community housing and other ways that we unearth people that can actually utilize this individual counseling. And I really think it's important that it is integrated into economic development. You may see like a coach in another department that's kind of isolated. I don't think that's the way for the county to go. These financial coaches are going to be really integrated into everything that we do. And Jennifer will go into the details more, but I'm really excited about this program and glad that we're going to be able to get it started right away. So with that, I will turn off my camera. Thank you.
Thank you, Hillary. And Jennifer Llewellyn, again, echoing already the incredible job that you and your team has done helping people respond on here. I think this proposal that you're going to be speaking to is one of those things that is desperately needed and added value to help Oakland County residents. So before I let Jennifer, you kind of explain what it's going to be, can I get a motion to take up the matter? Moved by Commissioner Gershenson, seconded by Commissioner Lubes. Jennifer, can you explain to us what we're looking at here?
Sure. Good afternoon, everyone. And thank you, Chairman Woodward, and thank you to Chief Deputy County Executive Chambers for their very kind words. As Hillary indicated, the last, I guess it's been 8 weeks or 9 weeks now, has been very overwhelming for our team. At the 6 Oakland County Michigan Works locations, we've received nearly 70,000 telephone calls. Last week was our highest week ever at that 9,999, which I was tempted to pick up the phone and call myself to make that 10,000th call. But the vast majority of those telephone calls are around the challenges related to the unemployment insurance system, which our team has just done a fantastic job of being retrained essentially overnight on how to take unemployment claims, how to make modifications to log in and help people access their benefits, but also just coaching them through the process. So essentially, we've been flipped upside down on our head to move from a reemployment system to an unemployment system. And I can't speak highly enough about the frontline staff who's been up against some really difficult calls over the course of the last few weeks. A significant number of those calls are around other financial issues as well, including food needs, burial costs for a family member, utility needs, medical bills. And we've have a great partnership with many organizations around Oakland County to be able to provide referrals and get individuals the immediate needs that they have. But there's an underlying sense of concerns about their current financial situation as well as their future financial situation. As many of you know, individuals can now receive the additional $600 weekly of pandemic unemployment insurance benefits through the end of July. But there's a lot of concern already growing about what happens after they lose that additional $600 each week. And then the maximum that they can receive is $362 per week. You know, this idea really came from Chief Deputy County Executive Chambers. And we talked about, you know, how do we better support those individuals by providing financial coaching. And as she indicated, we have a great partner in the Oakland Livingston Human Services Agency, or OLSA. We already use OLSA to provide success coaches through the Oakland County Business Resource Network, which is a similar model, but we provide support to employees of companies that sign on to the Business Resource Network. So we have 14 companies that currently belong to the Oakland County BRN. And the design of that program is to provide that coaching, including financial coaching, to individuals who are working, but they have challenges, financial challenges or other challenges that are interfering with their job. So we connected with OLSA, and the resolution in front of you recommends implementing 5 financial coaches, which would be who would be available to deliver services virtually and hopefully at some point on site at our 6 Oakland County Michigan Works locations and other public locations as well, or through other county departments. These financial coaches would assist individuals with assessing their family needs. So not just the needs of the individual, but their whole family. They would help them develop financial goals and put action plans into place. They would provide budgeting books, which we've already developed as part of the Business Resource Network, where an individual can create a customized plan for themselves and have a tracking mechanism to maintain their budget and achieve their goals, as well as other resource materials. These appointments would be available both virtually and hopefully at some point face-to-face, with a focus on financial wellness, connections to referrals, and then a development of a series of workshops and hopefully a virtual library that also supports financial coaching and literacy. This agreement would have a not to exceed amount of $334,000. Also would be reimbursed on a monthly basis for their actual costs. And those actual costs would include, you know, salary of the financial coaches, fringes, a small portion of administrative costs that's cost allocated based on their other grants, supplies, mileage for travel, and an allocated percentage of infrastructure costs. Also has 2 staff that are already trained in this financial coaching area that upon your approval, we believe could hit the ground running in, 14 days or so. The Oakland County Workforce Development Division of Michigan Works will provide oversight and coordination of the project through our existing grant. So there would be no additional dollars needed for the Workforce Development Division. And Liz Rivard Weston from my team, who coordinates the BRN program with OLSA, would coordinate this program as well. So we have an existing relationship there. OLSA would be required to report to us monthly on the number of individuals they served, what types of barriers they've overcame, share any success stories, and highlight any new connections or partnerships as a result. And I'm happy to answer any questions.
Okay, I got Commissioner Spiz, followed by Commissioner Gershenson, then Commissioner Zach.
Thank you, Mr. Chair. Thank you, Jennifer. Can you let me know why 5? Where did the number 5 come from?
So we didn't think that, we thought that 1 per Michigan Works office would be too many. And so based on the geographic boundaries, we identified that 1 coach could cover Pontiac and Waterford Michigan Works locations. 1 coach could cover our Troy and Oak Park Michigan Works locations. and one coach could cover Novi and Southfield locations. The other two coaches could support community home improvement and other county departments. That was how
All
it
right,
came.
thank you. And then based on the contract we have in front of us for the salary, that per year total? Or is that effective a certain date? Do you know? I didn't see it
That-
anywhere, so.
Yeah, that is the cost for an entire year for a coach.
So realistically, even if we start, let's say, June 1st, right? Or sooner, it's only gonna be realistically 6 months because that's the only time we can have the funding per the CARES Act. If I'm not mistaken. And I believe that's, Mr. Chairman, that's where the monies are being allocated from. So it would really be half that
That
cost.
was my understanding. But Jennifer, do you know, I mean, can you speak
Yes,
to
it
that
is.
question?
Yeah, it is CARES Act funding. It's my understanding CARES Act funding ends effective December 30th.
So realistically, assuming June 1st start, it'd be a 6-month period at this point. So instead of the 334, it'd be half of that, if I understand correctly.
Yes, that's why we have a not to exceed. And they'll be only reimbursed for actual costs during that time. So in their monthly reimbursement reports, they will submit documentation and reimbursement requests for actual salaries, fringe benefits, and other costs for that respective month.
Okay, and just one final question. Based on the contract, we're specific to 5 people. They couldn't come in and add more without coming back to the board for heads, even though they would fit within the financial of the 334,000. Is that correct?
We're capping it at 5.
Okay, thank you.
Thank you, Commissioner Spiz. Commissioner Gurchison, then Commissioner Zach.
Thank you, Mr. Chair. Jennifer, I just have to personally thank you for all the help you've given me in the middle of your almost 10,000 calls last week, that you personally took the time to answer some of the questions that I had been getting from constituents and your team. So I really, really appreciate that. And I just think this is such a great idea. And I'm thrilled that you're using an existing nonprofit that we've had a lot of experience with and that they have experience with. I think rather than going out to other organizations, this is just a natural partnership. So I really appreciate the efforts put into this program. Thank you.
Thank you, Commissioner Christensen. Yeah, they're great. This is in their wheelhouse. And so there's many things that are in our wheelhouse related to workforce development. Financial coaching isn't one of them, but also was a natural fit for this based on their expertise and proven results. Thank you.
Thank you. Commissioner Zach, followed by Commissioner Tao.
I love it and want to thank you for all that you're doing. So you talked about, are these evidence-based materials that we're using, or are they things that they've developed? What are the resources that they're working from?
That's a great question. I actually asked them the same question, Commissioner Zach, so thank you. Some of the materials are materials that they have developed, and some of the materials are evidence-based materials that they've received from other organizations. So it is a combination of both of those. And as you know, OLSA operates 70 other programs that support around financial literacy, financial coaching, and other needs. So their library of materials is vast and deep.
I like, we use the term one-stop shop, but if somebody walks in the door and they need financial literacy or something else, they have a whole menu of choices that OLSA can offer them. One final question. Our treasurer's office has a financial empowerment zone, program that we started. Our treasurer's office started it when we were having all these different tax foreclosures following 2008, 2009. And at the time, it was helpful to try and keep people in their homes. And our one-stop shop, or your office, didn't offer any type of financial counseling or stabilization. Wouldn't it make sense for them to really use OLSA to triage all of those needs beyond mortgage foreclosure toward this program rather than duplicating their efforts in their treasurer's office? What are your thoughts?
Yeah, I'm not very knowledgeable about that program, so I'm hesitant to comment on that because I'm not fully aware of the scope of what that offers, but I'd be happy to look into it and see if there's an opportunity for alignment there.
I would appreciate that. Thank you.
Thank you.
Thank you, Commissioner. I got Commissioner Taub, followed by Commissioner Jackson. Then Commissioner Kuhn. Commissioner Taub.
Thank you. And Jennifer, thank you we've been working together for what seems like eons. And I thank you for the work you do. It is amazing. I have a major problem, and somehow or other, I'm not getting your contract in my packet. I think because it wasn't sent to the proper email, that may be possible, but I don't want to, I wish somebody would send me it from the office so I could look it over. Are these people going to be our people working for us or for you? Or are they going to be working for OLSA and we're just giving OLSA the money? I don't know. I can't quite figure that one out.
Sure. So hopefully I can clarify. Nice to see you, Commissioner Taub. They are OLSA employees. They will remain OLSA employees. They are not county employees. I will have one county employee who's providing, project coordination and oversight, reporting, and general guidance. But the 5 financial coaches will be OLSA employees. And then OLSA, again, will submit a monthly reimbursement request to the Workforce Development Division that outlines the costs related to that employee, and they will be reimbursed with the funds if the Board of Commissioners so approves.
Okay, so you're going to hire them, or is OLSA going to hire them?
OLSA will hire them. They'll be employees of OLSA.
Okay, part of OLSA is also Livingston County. What is Livingston County putting into this?
I can't speak to that, but these 5 coaches will only be providing services through the Oakland County Michigan Works locations, community home improvement, and Oakland County based locations or residents.
Okay, so they will not be providing information for the Livingston County folks. Is that correct?
Not at this time. Yeah, not providing information to Livingston, Oakland County residents through Oakland County Michigan Works.
Okay, thank you very much. Thank you, Mr. Chair.
Correct. Thank you, Commissioner. Commissioner Jackson, then Commissioner Kuhn. Commissioner Jackson. Oh. Commissioner Jackson, I got to unmute.
Sorry about that. Hi, Jennifer. Good to see you today. And I just want to echo the thanks that everyone has already given you for this program. I sit on the board of OLSA, so I'm very familiar with some of the programs that they offer. And as we know, or maybe some of us may know, OLSA is a community action agency who specializes in helping people in need. As far as their services and financial literacy, they also offer services for help mortgage assistance, utility assistance, programs like that. Are they going to piggyback financial services information along with any help that they may offer? Say, for instance, if they want to help with utility bills, are they going to talk about conservation? Could you kind of brief us on that just a little bit?
Absolutely. Thank you, Commissioner Jackson, and nice to see you as well. Thank you for the kind words. This is why it's such a great idea to use OLSA, and exactly to your point is they offer 70 other programs. So when that individual comes in and has a significant need, maybe a utility issue, they already have in-house programs that can be utilized to address that individual's barriers, as opposed to referring them to yet another organization. I think, one of the other commissioners referenced earlier, a one-stop shop. So you think about it, someone's in a tough time, they reach out to either Oakland County Michigan Works or OLSA as a single point of entry, and we're working together to help them hopefully overcome those barriers, but also integrating it through our system to help them explore, how can they receive training in a new occupation, or how can we help them upgrade their skills within their current industry? How can we help them find employment? So it's a great marriage between both financial barriers and financial challenges, but also the employment challenges. So yes, they'll be integrating it into their existing grants, but also making referrals to other organizations when necessary.
And one more quick question. In the news lately, I've been hearing a lot about opportunities to be trained free of charge for contact tracers. Do you plan on doing anything along that line and helping talk about that new line of work that's going to be coming because of this pandemic?
Yes, that's a great question. I've connected with Oakland County Human Resources and also the Health Department about how we can support to train contact tracers moving forward. We do have a grant in through the state of Michigan. I think they applied for a $10 million grant from the Department of Labor to provide funding to the Michigan Works agencies to train contact tracer workers. So it's my understanding that right now there's not an immediate need through the health department, but as we move forward, what our hope is, or what my hope is that we can use some of those federal dollars that the Michigan Works Agency receives, train the contact tracers, and then help them secure employment, hopefully through the health department.
Thank you.
Thank you.
Thank you, Commissioner. I got Commissioner Kuhn up next. Commissioner Kuhn, and then followed by Commissioner Nelson. Commissioner Kuhn.
Yeah, thank you, Mr. Chair. I had a couple questions based on these documentations. You indicated that there were two individuals who were already trained. Does OLSA presently provide financial coaching?
They do provide financial coaching as part of their other programs, but they do not have a specific financial coaching program. It's built in as part of their utility assistance or childcare programs or our business resource network. But they've indicated to us that they have 2 employees right now that, upon approval could hit the ground running, ready to go on this project specifically. But the other 3 they would need to hire moving forward.
Okay, and do you have any time parameters on when they'd be able to actually hire and have trained these other 3 individuals?
They indicated that they are ready to move this along quickly, post the positions quickly, hire quickly, and they do have a great training model in place. So I'm confident that we could get the existing, the 2 that they've identified that are existing staff up in a few weeks, but it will take a bit of time to get the other individuals hired. I don't have a specific time frame. Obviously, it's contingent upon the candidates and identifying those candidates. But I know that this is the top priority for them, as it is for us, and they could move it along as quickly as possible.
Okay, well, thank you. And with regard to any of these programs, I'm always interested in whether the organization can provide some sort of objective measure of the outcomes or successes of their coaching. Do you have any thoughts on that?
We will be requiring of OLSA, and it is built into the agreement, a monthly report that measures, the number of individuals that they served, also measures, what type of barriers were identified and how many of those were overcome. Well, we're also requesting success stories. So examples of, how, their assistance or their help has helped an individual overcome their barriers. If there's individuals that we have enrolled in our programs through Michigan Works, we follow those individuals for 1 year and have different follow-up points over the course of that year. We usually touch base with them once per quarter. So I do think that there's an opportunity there for us to cross-reference data and see, how an individual was doing maybe at the time of financial coaching. And if they're one of our clients through Michigan Works, where are they at a year later?
Yeah, I certainly would appreciate as a board member to see any of that kind of outcome or success information. Like Commissioner Taub, I do not have a copy of this contract. So although I will vote for this, I would hope that we could put this on the regular agenda and have the actual contract in front of us before the meeting on Wednesday. Thank you,
Mr. Chair, it's in the packet on page 15 through 22.
The contract is.
Contract is,
So,
it's
Commissioner
exhibit
Coons,
3.
page 15 of the packet. But we'll make sure that all commissioners have that on the floor as well.
Yeah.
Next up, I've got, Commissioner Kuhn, were you done? I'm gonna say yes. You were. You're
I
good?
was done. Thank you.
Okay. All right,
Mr. Chair.
good. Commissioner Nelson.
I just wanted to reiterate what a lot of other commissioners had said. Thank you so much, Jennifer. I mean, I greatly appreciate your time, especially during a time like this where I can't even imagine. You have helped me tremendously. So I greatly appreciate it. Thank you so much.
Thank you.
Great, thank you. And I echo those same sense. Oh, Commissioner Whiteford.
Just my same, can you hear me?
Yep.
Just the same thoughts. I mean, you seem very excited about this, so it's going to be a nice fit, it's going to work out, and there's definitely an immediate need. So it's nice to see your excitement and enthusiasm in this. So I get a good sense on this. Appreciate
Yeah,
it.
thank you. It is something I'm personally excited about. It's not something that we've necessarily delivered before through Oakland County Michigan Works, and it's been one of those gaps. I've worked in the Oakland County Michigan Works system for 22 years now, and over the course of that career, sat across from a lot of folks that are just trying to figure out how they're going to make ends meet. Many of them are working. Sometimes they're working 2 jobs or 3 jobs, but just can't seem to find out a way to get ahead. I know you're all familiar with the United Way's Alice report, about the number of individuals who are working, but just can't get ahead. And I think that this is a great opportunity for us to marry both the workforce development and the financial literacy and financial coaching sides that we haven't done before. So while I understand this is CARES Act funding and available through the end of the year, I'm excited to see, what it looks like, and is it something we can explore further moving forward. So I'm glad you're able to sense my excitement.
Great, thank you.
Yeah,
All right.
Thank you.
Commissioner Taub for a second. Commissioner Loops for a first time, followed by Commissioner Taub for a second time. Commissioner Loops.
I wanted to say thank you, Jennifer, to you and your team. In the last couple of months, when residents asked me about unemployment, which was not in your wheelhouse, you were able to contact the people individually, and it was very effective and happened immediately. So thank you for your quick responses.
Thank you.
Thank you. Now Commissioner Taub for a second time.
Thank you, Jennifer. So I have some people who contacted me because they simply are unable to get into the unemployment office. They had actual shifts, one would call for a few hours, the next one they just can't get in. So your suggestion, sadly to say, is to contact you. Is that what you're suggesting?
Yes, Commissioner Taub, if you want to forward their contact information to me, you can pass along their name and the telephone number, the best way to reach them. And if you can include what city they live in, that's helpful. And I will connect them with one of our 6 offices. There's some things that we can help with. As I mentioned earlier, we have about 47 staff that have been trained in the last 5 weeks on how to take claims, resetting passwords and some parameters. But if there's eligibility issues, lack of payment, some of those are outside of our scope, but we're happy to at least give them a call, take a look at it, see if it's something we can help them with. If not, we'll have to refer them back to the 866 number, which is very difficult to get through, but we'll do our best to help them out.
Okay, thank you. That leads to my next question. We're going to have different people unemployed. I'm afraid this time you're going to have, not, the county will have, people who've had full-time jobs forever without work. Are you prepared to handle those people as well as people who sadly can't seem to get ahead and they're working 3 jobs?
Yes, we have an amazing team, and while I appreciate all the kind words and support, I really can't say enough about the team on the front lines. We have about 100 staff, spread across the 6 Oakland County Michigan Works locations who are working around the clock to make sure, not only are we addressing this unemployment issue now, but what does it look like in 2 months and 3 months and 6 months and a year? We're also getting a lot of support at the state level from Labor and Economic Opportunity Workforce Development, and exploring additional grant funds that we could receive to help support those workers. You know, hopefully everyone will have a job that they can come back to, but in the event that they don't, you know, our team stands ready and prepared. As I hope you've seen, you know, we've launched a series of virtual workshops that are available every day to the general public on resume writing and how to use LinkedIn and how to interview. So we've already started those efforts. We're working on a new campaign called Move Forward, which we'll be highlighting on social media and our website to encourage individuals to use the Michigan Works locations. We're advocating for funds at the federal level. There was some federal dollars in the HEROES Act, and hopefully we will receive some of those to help retrain workers. So, you know, we stand prepared and ready. A lot of the team that works in the Michigan Works system now also worked through 2008 through 2010. So we're, you know, dusting off some of the lessons learned from that period of time and seeing, you know, how can we re-implement some of those services.
Okay, so, you know, where does your funding come from? Does it come through the state, from the feds through the state, or are some of the dollars state dollars?
We are 100% funded through federal and state grants. So we don't receive any county resources through workforce development. Those federal dollars come from DOL, some from DHHS at the federal level. The majority of them are DOL dollars. We do get a small percentage of state dollars. Some of those have started to be recaptured in light of the state budget issues, but the vast majority are federal dollars.
And that's what concerns me, I guess. Yeah. Okay. I want to vote yes, but I have to see that contract. Mr. Chair, is this going to be on the regular agenda or the, what are your plans for this issue?
It will be placed on the regular agenda.
Okay, thank you, Mr. Chair.
So the contract's on, Commissioner, I think it's on page 15 of your, you can't get it? Okay, we'll get it. It'll have to be on page 15. We might also need a budget amendment to add what's in that contract into the actual resolution. I know that that's been being worked on, so we might have to amend it as well anyway. But it'll be on the regular agenda. Okay, any further comments on this? Well, Jennifer, I mean, I think it's all been said. You've really been pushing this office beyond its traditional function, and I think it speaks to you, your leadership, and the team. So thank you. Keep up the great work. Sandy, if you with that, let's call the roll.
Thank you. Commissioner Spiz,
Yes.
Zach,
Yes.
Jackson,
Yes.
Lubes,
Yes.
Nelson,
Yes.
Cobb,
Yes.
Wypert,
Yes.
Kuhn,
Yes.
Woodward,
Yes.
Gershenson.
Yes.
All right, you have a majority, 10-0.
All right, sufficient number voting in the affirmative. We will be recommending this to the board. It will be on the regular agenda and to be approved later this week. Brings us to item 3. Board of Commissioners calls for equity in COVID-19 testing, treatment, and prevention. And I need a motion for the discussion. Moved by Commissioner Lube. Well, how about moved by Commissioner Jackson's resolution, and seconded by Commissioner Lube's. And if I can let Commissioner Jackson speak to this.
Thank you, Chair. As the title of the resolution stated, this resolution is calling for equity in COVID-19 testing, treatment, and prevention. We know that this disease and epidemic has turned into a problem that has hit the highest on the most socially vulnerable people in our communities. The Center for Disease Control and Prevention has found that several racial minority groups account for disproportionate numbers of these cases and fatalities in the U.S. Here in Michigan, African Americans are the largest affected minority group and make up approximately 40% of deaths in the state, while only accounting for approximately 14%. This resolution therefore wants to bring forth further continued testing and demographic data being compiled along racial demographics so we can get a clear picture about how we should really address this pandemic now and in the future. We know that Southfield, Lathrop Village, Oak Park, Pontiac have the highest rates of COVID infections in our county, and also some of the highest or the highest populations of African American people. So this resolution is really brought forth to underscore the importance of really looking at this epidemic along those lines and how we're going to address it, test it, treat it, and prevent it. So that's all I have to say right now. Open it up for questions.
Commissioner Jackson, thank you very much. Is there any discussion on the resolution before us? We've got Commissioner Gershenson, Commissioner Kuhn. Is that Commissioner Spiz, or is that just being super cool? All right, all right, Commissioner Gershenson.
I just wanted to thank Commissioner Jackson. This is an issue that has been ignored for far too long, and I'm really glad you brought it up to the forefront, and that we're gonna voice our support about finding out this information and helping to try to rectify this issue.
Thank you, Commissioner. Commissioner Kuhn.
Thank you, Mr. Chair. I had a couple questions. In one of the whereas clauses, it mentioned creating a culturally relevant communication strategies. Can you give me some examples of that? If possible.
Sure. I don't know if you've heard the term of ethnic marketing. There's a way to deliver and relay messages to convey information that is accepted differently amongst certain communities. In the very beginning of this pandemic, I mentioned personally in a meeting, and people laughed in the meeting, and I said, I wasn't trying to be funny, but at the onset of this disease, before it started striking the African American community so hard, rumors on the internet were persisting, saying that African Americans were immune to this disease. And people were really saying that, in relationship to, oh, well, I don't have to worry. And so what we have to do is just ensure the things that we communicate as we treat this disease, we target some of the information in a way that's more readily digestible, acceptable. We talk about people going up north right now to their cottages and not spreading it to rural areas that might have hospitals that could be overwhelmed. But we also have to talk about certain things that minorities do when they gather. Okay, we talk about restaurants, but there's certain things that, and I'm not trying to stereotype my community at all, but we like to play cards, and you're at a facial closeness when you sit around a table and play cards, when you have a backyard barbecue. There's just certain things that we have to relay amongst ourselves that I have not seen. I haven't seen in any of our information yet, and I know that our executive office is thinking about these things, but just to call forth it. That's
Okay, well, thank you. I had a couple other questions, Mr. Chair, if that would be okay.
Go ahead. Yes.
Okay, and in the resolution, it indicates what the CDC report on demographics, that approximately 50 to 60% failed to specify the race and ethnicity. I was wondering if anyone knew what our statistics were on that. Oakland County statistics on that.
It's on the dashboard.
Yeah, we do have information on the dashboard, but then also we have to make sure, and And I did call about the dashboard and was assured that we are including information gained from hospitals and other sources of testing. But then at the same time, as we expand our testing, and we have places like Walgreens that are trying to get into the testing, and at our healthcare facilities where a lot of vulnerable workers are employed, we just have to continue to ensure that we push for overall reporting of the testing, which I don't think we're sure that we have 100% at this time.
Okay, well, thank you. And again, although I support the vast majority of this resolution, there are several provisions that I do not support, so I will not be voting for it.
Okay, thank you, Commissioner.
Thank you, thank you, Mr. Chair.
Commissioner Taub had her hand up. Commissioner Taub.
Thank you. I understand exactly what is in this resolution. I would like to offer an amendment if I can. And the amendment I'm going to offer is on the second, be it further resolved. Just one second, yeah. Where it says efforts to expand testing, I would like to add and contact tracing. I feel it's so important because, sadly, we should never have put any of our senior citizens, whether they live in Detroit, Southfield, or Bloomfield, you figure it out, okay, back into nursing homes when they had COVID. And I think that created a tremendously horrible problem. I also think that we need to do a lot of contact tracing on where people, as you said, Commissioner Jackson, were they just sitting at home and all of a sudden they got sick? Or, and no matter who it is, which ethnic group, or were they busy going to a graduation party for 250 people in a backyard? I mean, I think that should be important. So I'd like to ask you for your permission to add the words and contact tracing so that we can know where people got sick, how they got sick. And we aren't doing enough of that. I don't believe in any community.
In my response to that, like my knee-jerk response, like firsthand, because I realize that contact tracing is a very necessary component as we do testing and we go out to try to combat this pandemic. However, we already discussed contact tracing, I believe, thus far in a different context up to this point. I can't remember exactly, but I think at our last meeting, we were, I think we're going down another avenue in trying to solicit and go about contact tracing. And I know Jennifer spoke about it for a moment. So it does fit within the whole context of this, but maybe it should be contained in another resolution. I don't know. I mean,
Well,
we could vote on.
My thought is that, yeah, we're going to draw blood or we're going to take a nose swab or a throat swab or something. But when it comes back positive, where were you that you contracted the virus? Okay. Because the people with whom you associated during that 14-day period on a positive test are very crucial. It could have been grandma. It could have been. So that's why I'm asking to do it in conjunction with the testing in minority groups, because I think that's just as important as finding out yay or nay, I have it or I don't have it. If you don't know where people were, then you can't contact grandma or Aunt Millie or the neighbor down the street and say, look, you've been exposed, stay inside for 14 days. If you don't have that, then testing means absolutely nothing. Yeah, either you have the virus or you don't have the virus. If you have it, who have you exposed? Who can we say, watch out, don't go out and expose 10, 20, 40. This is a highly, highly contagious virus. And contact tracing is not just, something else to do. It's to try to eliminate it while we have and get the information while we can. What if somebody went to a card game, there are 6 people there, they get tested the next day? We should know that, so those 6 people can know you have to isolate yourself. You have to quarantine yourself for 14 days. So I think those 2 things go hand in hand. I don't think they're separate entities. Thank you, Mr. Chair.
Okay. If I may, on that note, I think Commissioner Jackson made reference the contact tracing that we have asked for a report from the Health Division. Oakland County really does have more contact tracers than any other county in the entire state. And I think there's a lot of evidence that says we're going to need even more based on recommendation and what's required, because I agree with you, Commissioner Taub, it does go hand in hand. And I think we will be having that conversation at this committee very soon. I don't know if it'll be the next meeting or the one after. Whatever. I know that the Health Division and Kathy Forsley and Leanne Stafford have been working on a proposal. How are we going to bulk up? I believe we have 150 trained contact tracers, which is great. And some recommendations I've seen say we need upwards of 375 or more. And so all of that's going to be required to do the contact tracing. Any further discussion? Seeing none, Madam Sandy, if you can call the roll, please.
Wait a minute. I made a motion, sir.
Oh, I didn't hear a second. I'm sorry. Commissioner
Second.
Taub, a motion by Commissioner Taub, seconded by Commissioner Kuhn. Can you state your motion again, Commissioner Taub?
Yes. And the second, be it further resolved, tremendous efforts to expand testing in cities. I'd like to add testing and contact tracing, because I think they go hand in hand, and that way we're not eliminating one or the other. We don't need a separate resolution for contact tracing. I think needs to be stated that we all need to know who needs to go into quarantine or not. Thank you, Mr. Chair.
Thank you, Commissioner. Okay. Any further discussion on the amendment? Commissioner Gershenson.
Yes, can I just get clarification from the author of the resolution that you do not think this is necessary at this time?
Commissioner Jackson.
Yes, thank you, Chair. Thank you, Commissioner Gershenson and Commissioner Todd. I do feel as though contact tracing is, and I'm repeating it, is an integral part of this whole process of trying to address this pandemic. However, this resolution contains a lot of further it be resolved information in regards to looking at the minority community healthcare needs. I just feel as though sometimes minority and African American issues take the brunt of so much other things that get lost. Okay, I feel as though what I really want to see from this is where we are now at this point in time and the deaths that have occurred. And as we approach this, the contact tracing is another big action in itself. And so I think it could muddy some of the work that this resolution is calling for. And that's just my opinion, bringing this here, because we don't know exactly, even though we have some trained contact tracers, the procedure, the requirements, the implications of it yet. Here, and the ideas in this resolution basically have been proven and are things that we have been looking at anyway. In our past, even in our past budget, we looked at minority health care, and we looked at the delivery of health care to the underprivileged. So I just don't think at this point it should include that. And that's just my feeling about it. Thank you.
Thank you, Commissioner.
Thank you.
Any further discussion on the resolution? Seeing Commissioner Todd?
Yes, my concern is keeping the entire community safe after someone has been tested positive. So I will not be supporting this because I can't in good conscience say the minority communities will be safe if there's no contact tracing, I'm sorry.
Okay, Commissioner, Todd, like I said, two things. One, this is on your amendment. So I want to make sure that we're still talking about the amendment.
I'm sorry.
Second, I think from my hearing from Commissioner Jackson, is that there's willingness, can we, get another resolution up and running that speaks to the importance of contact tracing? We also have a report coming forward. I think that Commissioner Jackson's, urging us to move this resolution as is, and if we want to talk about contract tracing, we do it in another one. So I don't want to put words in Commissioner Jackson's mouth, but I think that's the essence to keep this focused on racial equity in testing. Is the intent of this resolution. But seeing no further discussion on the amendment proposed by Commissioner Taub, seconded by Commissioner Kuhn. Sandy, if you can call the roll on the amendment.
Yes, on the amendment, Commissioner Zach,
Yes. Oh, no, I'm sorry. No on the amendment.
Jackson,
No.
Boobs,
No.
Nelson,
No.
Cobb,
Yes,
Whitebert,
Yes.
Kuhn,
Yes.
Woodward,
No.
Gershenson,
No.
Biz,
No.
you have a motion fails 3-7.
Okay, the motion fails. It brings us back to the main motion. Any further discussion on the main motion? Commissioner Taub?
yes. In the first now therefore it be resolved, it says it calls for equity in COVID-19 testing, treatment, and prevention. Now, the only known prevention right now is contact tracing and quarantining. So I don't know why we can't include that in the resolution. I have difficulty with it. Because if you deny contact tracing, then you may as well just open everything up and have people sit next to each other. Thank you,
Commissioner,
Mr. Chair.
I'm gonna weigh in there. It's like, no one is saying we're denying contact tracing. Oakland County's got more contact tracers than any other county in the state. Some of the best trained. We haven't, actually, I don't believe we even contract out yet. We actually train folks in-house to be able to do that. It is absolutely a very important, critical component among a whole series of things. Education is maybe arguably the most effective, culturally sensitive, when trusted advisors and how to be able to prevent this. No one's denying that, and I think that there's interest. If we want a contact tracing resolution, by all means, I would even volunteer to work with it so we can have a formal declaration about the importance of contact tracing. I don't think anyone disagrees about the importance of it.
But you're saying by not putting in this resolution that for certain groups of people, it's not important, and it is.
Commissioner Taub, that's completely false. Commissioner Jackson.
Thank you, Chair and Commissioner Todd. I just want to say, and that's kind of what I'm getting at. It almost seems as though if we placed it in this resolution that is speaking to equity and racial demographics, it's almost like we are pinpointing these demographics and racial groups to be targeted for contact tracing. When contact tracing should be administered to the public as a whole. And so that's all I have to say.
All right. I think we've talked this issue to death enough. Sandy, why don't we call the roll on the resolution as presented?
Yes, on the resolution, Commissioner Jackson,
Yes. Thank you.
Boobs,
Yes.
Nelson,
Yes.
Cobb,
No.
Seibert,
Yes.
Kuhn,
No.
Woodward,
Yes.
Gershenson,
Yes,
Biz,
Yes.
Zach,
Yes.
motion passes 8-2.
Okay. Motion passes and we refer to the board. Will also be placed on the regular agenda. Okay, and since we took off item 4, that's the end of our agenda. So we will be adjourning at 2:38.